I'm a pediatric surgeon. I'm very humbled by my colleagues here because I actually don't have to deal with this very much. So why am I involved in this? Because I believe that this will fundamentally move our profession and really our society to a very dangerous level. And whether you're going to be a radiologist or a dermatologist or a surgeon or an internist or a palliative care physician, it will affect us. It will affect us by changing the culture of care that we provide. And I don't use this word lightly, but potentially making our hospital killing fields for patients, which I think would really disintegrate the entire structure of how we provide care. Now, I wrote an article in the Gazette recently, and I actually started it with a small story from one of our nurses. She and her husband were both nurses, and they were homeschooling their 4 children. And when the crisis hit last fall around Easter, and here in Quebec, people were dying by the droves in nursing homes, they dropped everything, and they went and volunteered and had their grandparents take care of their kids. And she and her husband both got COVID and were ill. And after she recovered, she posted why she did that, because people thought, why would an emergency room nurse who's homeschooling 4 kids do this? And her rationale was very simple, is that as a healthcare professional, she really believed that everybody counted. You might be incontinent, you might be demented, you might be looked at as disposable, but that you were still a human being and there was something called the gift of life that you enjoyed. And in her post, she explained why this was important to her. And I actually used her comments to start my article in the Gazette, which you can access by just searching my name on the Montreal Gazette website or on Google. So this is really a fundamental issue to who we are as a society, to how we look at suffering, to how we look at death, and to how we look at healthcare. It is really about the larger picture, regardless of where you're practicing and regardless of how often you're going to have to deal with this. The second issue is that this is really an issue of how we interact with organized medicine and our healthcare organization. Now, I'm not against organized medicine. I'm a member of every organized medical society and college that I have or have not to be voluntarily. I'm a member of many things, but we also have to recognize when we fail. I'm American and I trained here in Canada, and that was my link, and I came back after many years in the States. And in the States, there was really kind of a culture against universal healthcare. And unfortunately, as you all pretty well know, organized medicine hasn't really done anything. The American Medical Association has not done anything to foster universal coverage. None of really the professional organizations have. And so in some instances, and this is really my appeal to you as young people who are students now, maybe there are some residents among us, but really within a very short period of time, you will be the ones leading these arguments and leading this discussion. Your mentors will teach you lots of great things, and there will be a lot of things to learn from those who came before you. But there will be some things where your mentors will fail. And I'm sorry to say that as somebody who sees myself as a mentor to young students. They might fail on healthcare policies. We are failing miserably as a healthcare community on this issue of MAID. The Royal College about 2 weeks ago sponsored a educational session on C7. And they acted as if C7 was already law and basically invited 6 panelists who all were clearly biased towards C7. And we were not asking them to have a panel like we had tonight, a panel that just expresses its concerns. We were just asking for balance. And yet none of the panelists, and maybe some of you watched that, none of the panelists even disclosed their bias before speaking. And the same goes for the Canadian Medical Association and really most colleges in most provinces. For some reason, they felt this was a politically expedient issue and really jumped on the bandwagon. As Dr. Coelho said, this has not been an issue of evidence. I mean, since when do we pass laws that govern medical practice without looking at evidence for this practice? So I really plead with you to look past organized medicine, to look past the organization that you're members of, and to really take on your own advocacy. And maybe, Jeremy, you can show the picture that I just wanted to end with. The picture Jeremy is about to show is a group of medical students in California, where I spent really most of my career before coming back here. And I practiced in Orange County. And if any of you know anything about the US, even though it's in California, a very liberal state, Orange County is really a hotbed for political conservatism in the US. And these students were always taught by their mentors about, you know, there's no such thing as universal care, that's socialized medicine, and, you know, all the propaganda we hear about why we do not want universal single payer care in the US. But the students took it upon themselves, knowing that other people will not lead, their mentors were not going to lead, their organizations were not going to lead. They took it upon themselves to start the movement for a single payer, essentially a Canadian style healthcare system in the state of California. And they would go and demonstrate once a year and have these retreats and go in front of the Capitol in Sacramento. And guess what? Politicians would never listen to individual physicians or small groups of physicians, actually started listening to these medical students, and things started moving in the legislature towards that goal. And at one point, a bill was actually introduced. So do not ever underestimate your power as future healthcare professionals, as students and residents, because you are still carrying that idealistic spark that really pushed all of us to get into this. And it's really not about numbers. If you and a few colleagues find that this is really important to you, that this makes sense, that we need to fight this in Canada, that this is going to potentially destroy our healthcare environment, then please make a point of educating yourself more and you know, look at all sides of the spectrum. I'm not asking you to just look at the points of view that were expressed here. Look at the opposite points of view. You should educate yourself on the entire spectrum and come to your own decisions. You're all superbly intelligent and capable people. But my passion about this is not because I may have to do it tomorrow or next week or the week after. My passion is I don't want to see the country I practice in and the healthcare profession that I've invested my life in become a culture of death. And I really believe from the bottom of my heart that this is where we're heading. And that's all I wanted to say. Thank you.